Ever wondered why wounds seem to take longer to heal if you have diabetes? It's a question that puzzles many, because on the surface there seems to be no connection. But when we delve deeper, the relationship between diabetes and wound healing is far more intricate than it initially appears. Diabetes, a global health concern affecting millions, holds an insidious influence over the body's ability to mend itself. One of the most common observations among those with this condition is a slowed wound healing process. It's not a mere coincidence, but a complex interplay of biological factors all influenced by the presence of diabetes. So, why does this happen? What's going on beneath the skin's surface that makes healing a more arduous task for diabetics? And what does this mean for those living with diabetes, their health, and their quality of life? These are the questions we'll be exploring. Today, we unravel the science behind this phenomenon. Diabetes, a seemingly unrelated condition, has a profound impact on wound healing. But how? We're about to delve into the science behind this phenomenon. To understand the connection between diabetes and wound healing, we first need to look at blood sugar levels. Elevated blood sugar, a hallmark of diabetes, can cause various complications in the body. One of these complications is the impairment of wound healing. Imagine that your blood vessels are like highways, with nutrients and oxygen being the cargo that needs to be delivered to your cells. High blood sugar levels can damage these highways, making it difficult for the body to deliver essential nutrients and oxygen. This restricts the body's ability to repair and regenerate tissues, causing wounds to heal slower than they would in a person without diabetes. But that's not all. High blood sugar also affects the immune system. White blood cells, the body's primary defense against infection, are less effective in a high-sugar environment. This means that when a person with diabetes gets a wound, their body is less equipped to fight off any potential infections, further delaying the healing process. Then there's the body's inflammatory response. Inflammation is a normal part of wound healing, bringing in white blood cells to fight off infection and kickstart the healing process. However, in people with diabetes, this inflammatory response can become prolonged. Instead of helping, this chronic inflammation can actually delay healing, causing wounds to linger for longer periods. Finally, high blood sugar can interfere with the growth of new blood vessels, a process called angiogenesis, which is crucial for wound healing. Without new blood vessels to deliver oxygen and nutrients, wounds may not heal as quickly or effectively. So, while diabetes and wound healing may seem unrelated at first glance, there's a complex interplay at work here. Elevated blood sugar disrupts multiple bodily processes, from nutrient delivery to immune response, all of which can slow down wound healing. So it's clear that diabetes introduces a set of complex issues that slow down the healing process. Let's rewind and quickly summarize what we've learned about diabetes and wound healing. We've learned that high blood sugar levels in diabetics can have a damaging effect on the body's ability to heal wounds. This is due to a combination of factors. Firstly, high sugar levels can damage blood vessels, reducing the flow of oxygen and nutrients to the wound. Secondly, diabetes often comes with an impaired immune response, making it harder for the body to fight off infections that can hinder wound healing. Lastly, the inflammatory response, crucial for the healing process, is altered in people with diabetes, which can further delay the healing process. These factors together explain why wounds may take longer to heal in people with diabetes. Remember, understanding is the first step towards better management. Stay informed, stay healthy.